Right. Okay, I think we can go ahead and get started. Hello and good afternoon. My name is Abuko Estrada. I'm the Vice President of Medicaid and Child Health Policy at First Focus on Children. If you're not familiar with us, First Focus on Children is a national bipartisan advocacy organization dedicated to making children the priority in federal policy and budget decisions. First off, I want to thank all of you for taking time out of your busy days, especially on a Friday, to join us and our partners from Duke University and Unidos US for this important, very timely discussion on how the design of safety net programs can improve outcomes for Hispanic children. In terms of housekeeping, we do ask that if you have any questions that pop up throughout the discussion, that you please use the Q&A function. Today, during this briefing, we're going to hear a presentation from Dr. Lisa Janetian. Dr. Janetian is the Pritzker Professor of Early Learning Policy Studies at Duke University. She has a body of research on child poverty among Hispanic children and has spent a lot of energy in learning about how program design can support engagement in public benefit programs. We're grateful to have Dr. Janetian here today to share her expertise and insights with you. Following the presentation, we will have a brief update regarding Medicaid and SNAP from myself and Hannah Gerlich, Health Policy Analyst from Unidos US. We are grateful for Hannah joining the conversation as well. Following those brief updates, we will then open it up for questions. And now, finally, in turning this over to Ruby Flores for some remarks, I want to give a very special thank you from First Focus on Children to the Congressional Hispanic Caucus for its cooperation with this event and allowing us to share this briefing with you today. So without further ado, Ruby, the floor is yours.
Hey everyone, thank you again and apologies for being off camera. I know we all have been dealing with so much this last week, from in LA to obviously yesterday's events. So echoing Abuka's thanks to folks that joined. I know this is obviously still a huge priority for us, and we'll continue to do so. Um, Obviously, we know this is going to be still debated in the Senate. It's going to come back to us, and as appropriation season is in full swing, something that we all want to keep track of, right? And so, excited to have this important conversation and to have some expert insights into how we can be tracking this, engaging on this. And it's something that we'll continue to share with the rest of the caucus. And I know we'll be having this initial conversation recorded, and we'll circulate that to the rest of the folks that couldn't attend. But just a huge thank you again to the briefers today, to First Focus Children, to Unidos, to the folks on from Duke. I know it's going to be a super impactful conversation, and something that the caucus will continue to throw its support behind so that we can make sure that we are all equipped to respond in the most appropriate way possible. So just huge thank you again. And we'll continue this engagement, not just for this briefing and for this information, but to actually get things done right in the coming Congress, and beyond. So appreciate for the partnership, and I'll turn it back to you.
All right, thank you, thank you. And so with that, we will turn it over to Dr. Janetian to provide her presentation.
Okay, fantastic. Thank you, everyone, and for the kind introductions. I'm going to pop up some slides, and I assume that everyone can see this little nod. Okay, wonderful. I was delighted to be invited to share today with all of you some of the many things that we've been learning, studying safety net programs, circumstances of poverty, specifically among Hispanic children. I want to acknowledge that this work is not just my own. I'm representing a large body of folks, including senior collaborators Marcos Rangel here at Duke, Dana Thompson, who's presently at Rand, and a host of graduate students and postdoctorates and research associates at the National Center for Research on Hispanic Families and Children. So one of the many things that I've learned in examining and thinking about Latino children in the US, I'm going to just step back for a second, and that has to do with identity and labeling. And we've used the word Hispanic, but indeed Latino, Hispanic, and different variations of Latino are used quite interchangeably, reflecting ancestry, origins, geography, time, generation. It matters in different ways for different populations. I have a site here for Pew Research. For the purposes of this talk, I'm going to be using the language of Latino, recognizing that there are different uses and ways of representing this population, how they self-identify, and how governments choose to identify this group. I wanted to kick off today's important conversation by highlighting why a policy lens on Latino children matters quite a bit. And the first starting point for this is population. Latino children make up 1 out of 4 of the US child population under the age of 18 and are projected to be the fastest growing youth demographic through 2060. This chart is a nice representation of this, sort of demonstrating in orange is the Latino or Hispanic child population. And you can see in 1980 that the orange square is, relatively small relative to white and other groups. And its projection over time growing up to 1/3 of the child population as projected in 2050. The second important kind of fact, stylized fact, that's important for level setting and thinking about safety net programs is that Latino children represent the largest share of children living in poverty. To put this in context, in 2022, about 9 million total children in the US were residing in poverty according to an official measure of poverty, and 3.7 of the 9 million identified as Latino, which is approximately 40%. Now, it's always important to think about child poverty in context and what's happening over time. This chart here is a measure of what's called the child supplemental poverty rate. So this just adjusts for some costs, including childcare, and also includes the income or the income equivalent of many transfer and benefit programs. I want to highlight 2 points in this chart that relate to today's talk. One is you'll see that trends in child poverty were declining over time. This starts in 2009. With a particular decrease happening in 2021, and that was largely in response to pandemic-related expansions, particularly the expanded child tax credit, which many families who did not receive the child tax credit received it for the first time. And you can see the uptick happening in 2023, and this is because of the retraction of those pandemic-related benefits in addition to other economic factors. So one big takeaway from this chart is that child poverty is very responsive to safety net programs, particularly the expansions. But the second equally important takeaway from this chart is even though we're seeing these decreasing trends, gaps and differences between children in different groups exist and persist. Latino child poverty and Black child poverty consistently remain higher than non-Hispanic white peers. The third important point that we will come back to directly in the context of safety net programs is that many Latino families with children have significant and high labor force participation, and many eligible Latino families with children have lower uptake of government assistance. So lots of children in the US and the young population in the US are Latino. Latino children represent a large share of children in poverty. And Latino children with low income reside in families with high labor force participation and lower uptake of government assistance. So we think about policy, it's important to think about the broader context. One of those key aspects of the broader context is geography. And this intersects quite closely with the conversations that we're having today in this relationship between federal policy and then state and local policies. Latino families with low income are concentrated in approximately 20 states. The growth among the Latino population is happening nationwide. This next chart offers a rendering. It looks like the map of the US. Each of these boxes present a statistic relating to the proportion of Latino children in low income. And the circles here just are simply for the purpose of highlighting the states in which there is a high proportion of Latino children with low income. And you'll see a pattern here that intersects quite closely with thinking about state policymaking, that most Latino children in the US, most Latino children in the US who are likely to be eligible and receiving benefits from the government are in the West and Southwest, the Northeast, and the Southeast. And this is not to dismiss the importance of Latino children in other states, but rather to elevate the importance of the role that particular states can have when we're thinking about this growing population of Latino children. The other important aspect of context when we think about policies is the set of criteria that intersect with income that affect kind of the eligibility criteria for receiving benefits. And so I want to highlight a few here. One is the far majority, over 90% of Latino children are US born and residing with two parents. Many live in multi-generational households. 1/4 of Latino children reside with an adult who is an unauthorized immigrant. And over half of Latino children are bilingual. This is a skill linked to future economic gains. But also, I want to mention, or at least thread together, these three characteristics around citizenship, around parents in the household, and other adults in the household, and literacy and proficiency of language are all elements that affect experiences, access, and receipt of safety net programs. So as part of our work and our research and thinking about programs and policies, we are, aligned on the goal of thinking about Latino family economic well-being. And the two major sources of income that we think about when we think about economic well-being come from earnings, so paid employment that contributes to earnings from paid work. And then how the government can be part of supporting families, either through in-kind benefits like the Medicaid and the food subsidies, or directly through things like tax credits and cash assistance. I'd like to spend a moment to talk about what we're learning along both those lines. So first, and importantly, going back to my third kind of why this matters, there's high employment among families with Latino children. 9 out of 10 Latino children with low income live with an employed adult. Money in Latino households with low income is mostly from earnings from paid work. Working Latino parents with low incomes are concentrated in sectors and occupations with low wages, irregular work schedules, and limited benefits, including sectors such as construction and food services. And this is important to keep in mind because these are also sectors that respond and are quite sensitive to economic shocks, and including public health shocks such as the pandemic, recessions, and other types of natural disasters. This is also important to keep in mind if we're thinking about working families doing the hard work of raising children and juggling that responsibility as parents with work. Secondly, I set the context of rates of poverty and high, that means high eligibility among Latino households with children. But what we see is lower than expected receipt of government assistance. So I want to talk through this for just a second to offer some kind of more stylized facts around this. And so in this chart, on the bottom row is featuring 4 programs. These happen to be quite important, especially the first 3, in terms of their anti-poverty effects and improving children's or reducing child poverty. But also these are programs that we can easily measure from nationally representative data sets. Medicaid, SNAP, and WIC would be considered in-kind programs. In the case of Medicaid, subsidizing healthcare, you'll hear more about that later. In the case of SNAP, Supplemental Nutrition Assistance Program and Women, Infant, Children's Program, these are both designed to subsidize food. In the case of WIC, it would be families with young children. And on the right is the cash assistance component of the Temporary Assistance for Needy Families program, which is our only basic cash assistance program right now in the US. What I want to show you next is our estimates of uptake or receipt of these benefits separately for Latino households with children versus their peers, non-Latino households with children. And I'm showing these for 3 different levels of poverty. We can think about households in deep poverty under 100%. And then as we go up to 130 to 150% and even higher, one way to think about households in those levels of poverty are working poor families, but yet still eligible under 150% for most of the programs I'm talking about here. And so what we see on the left is high coverage and receipt of Medicaid, some difference between Latino and non-Latino families, and also slightly higher rates of receipt among Latino families. This differs a bit from a program such as SNAP, which is designed to subsidize food. Where here we see equivalently eligible families according to poverty status, but very different rates of receipt, where eligible Latino families with children are less likely to receive SNAP benefits. With WIC, rates are pretty comparable across both groups. Note here that the receipt is a little lower because the population is all children, and WIC, as I mentioned previously, is households with young children. And then here with TANF cash assistance, we again see a little bit of a differential, especially for the lowest income under 100% of poverty, where non-Latino households are more likely to receive TANF basic cash assistance than their income eligible peers that are Latino households with children. So this is a mixed picture. For 2 of the big anti-poverty programs for children, SNAP and TANF basic cash assistance, we see lower rates of receipt among eligible Latino households. And then for 2 other programs, Medicaid and WIC, we see pretty comparable, if not slightly higher rates among Latino households with children. This matters. Let's take the example of TANF and SNAP. If we took a hypothetical family of 4 at about $30,000, which is about the official poverty level, the combination of not receiving cash assistance and SNAP benefits in their income equivalents means that they are missing out on a potentially 50% increase in financial resources for the Latino households. So we became really interested in this. Why is it that we're seeing at equivalent rates of poverty differential receipt? And we were particularly interested in what the role of program design and implementation might be in explaining some of these differences. When we try to unpack how much of these differences across states are due to poverty versus elements of design and implementation that states have authority, we learned that a lot of the difference between Latinos and non-Latinos, especially in cash assistance, have nothing to do with differences in rates of poverty, right? Which raises this question, well, what is it? And what we're trying to do here is understand could it potentially be something about how these are designed? When we talk about policy and program design, we are thinking about things such as you might characterize as positive practices, having bilingual materials and real-time on-site language translation available, co-location with other services, dedicated staff to answer questions about immigrant families' eligibility, community outreach that includes Latino communities. You might also think about things that you can imagine might be barriers for Latino households. Collecting documentation, potentially for all members of a household, even those that might not be the intended recipients of benefits. Having short recertification periods that would require kind of repeat information on documentation on things like work hours, which might be more difficult to get if one is working multiple jobs, and limited language and literacy translation. One of the ways that we engage in this work is to look at how states, what kind of language and what they're using and what information is available on their publicly available portals. The other is to use the data we have and some data gathering exercises. So I wanted to share a little bit of both and offer some conclusions in terms of what we're learning. And so we're learning that there are some information gaps. You know, when you ask eligible Latino families why they're not receiving benefits, they'll say things like, I didn't know. And they'll say things like, we don't need them. And they'll also say things like, we have concerns related to immigration, including fully citizen families. When we go to websites, these are a little from outdated, meaning we haven't done a recent, but I wanted to offer an example of language that is available in kind of the public portals in which families might be engaging with benefit systems. These are 3 snapshots from the state of Georgia, state of New Mexico, and from Arizona, where different languages used related to kind of immigration and immigration enforcement and the implications of giving information. So just to be clear, these are not on immigration-based portals. This is language that is used and made available to families who are seeking safety net program benefits. In our work in New Mexico, we learned that immigration ambassadors are hired as full staff in each of the regional officers. And the frontline workers here directly speak to this when they were asked about serving Latino community members in their state. They directly talk about the fear of Hispanic households, the fear they express of being deported or losing the opportunity to be a citizen. And having access to applications and generous help with applications could be very helpful. And they talk about needing people who are fluent in Spanish and various indigenous Spanish languages. And that, the use of the language line might not be as helpful as having a human to support kind of those steps of application. And mentioning the importance of having people trained properly. In this endeavor to piece the various elements of state policies and practices, we try to characterize what states might do in terms of policy design in 2 different ways. And the first is, you'll see labeled here, something called cost minimization, but let me just translate that into how can we efficiently allocate potentially limited government dollars towards a set of safety net programs. And so here you can think about eligibility criteria, for example, to help maximize that the neediest kind of families are the ones in which limited public dollars are going to. So when we code this up on this index, we learn right away that there's enormous variation across the states, right? So all 50 states are on the left, and you see this index goes all the way from a -2 to a 3, and there's enormous variation. And so the takeaway here is states have a lot of traction and states do many different things in order to be efficient in their allocation of safety net dollars. We then took another perspective, which is the perspective of families. So what are the steps and hurdles and things that families need to do, to be able to find out about safety net programs, to apply to safety net programs, and ultimately to receive benefits? This view is coming from something called administrative burden. When we do that coding exercise, we also find a lot of state variation, right? So this varies from -0.5 to a little bit over 2. And so in both of these views, efficient allocation of dollars at the state and local level in ways that state might design policies, and putting in kind of hoops and hurdles and ways of screening that might be quite burdensome for families, there is a lot of state variation. We took these indices and then kind of imposed them in data on receipt because we wanted to answer this question, does this matter? Does this predict receipt of benefits? In this particular case, we're focused on basic cash assistance from the TANF program. And what we learned from those analyses is the answer is yes. And so on this far right, again, the red bar represents Latino households with children, and the blue dots would be non-Latino households with children that otherwise look comparable over a set of characteristics, namely levels of poverty. And what we find is these policy structures and designs and choices do have an impact on receipt. And in this case, we see a pretty big 2 percentage point reduction in the likelihood of receiving TANF cash assistance among Latino households with children who are the lowest income, right? 50% of the federal poverty level. So it's a pretty substantial effect for households that are responding to how these policies are designed at the state level. This week, and indeed today, the topic of our conversation is about children. I want to go back to children before I hand it over to my colleagues. There is a body of literature, much more than I can talk about today, that safety net programs support children's development directly by increasing net household income and through other channels, such as directly subsidizing nutrition and healthcare. Part of what I've tried to describe in my time today with all of you is that eligible Latino children, despite high rates of poverty, are less likely to receive these benefits. What our work has also shown is federal policy is important, especially in that first kind of line of legislation and availability of resources, but so is state policy and the decisions that state policy and local policymakers make around design and practices. And this overlays quite closely with where Latino children are geographically concentrated in the US. When we put all these pieces together empirically, we do find a direct thread of more restrictive and burdensome state policies that can reduce benefit receipt, that then affects poverty, that then puts children's schooling and health at risk. So in summary, safety net program design and implementation affect uptake among eligible families, including Latino working families with low income. There is high employment among Latino households with low income and children, and community ties and other ingredients that are strengths that policies can build on. Examples of those include things like expanding childcare around places of employment, adult education and training, from the perspective of continued kind of career and earnings growth, and partnering with trusted local organizations that can both tackle awareness, information, as well as improve trust. Thank you. And I will stop share.
Thank you, Dr. Giannetti, and I appreciate that. That was a wonderful presentation. Lots of great information. I know I learned a lot. It's got the gears turning for me. And so with that, I do want to move us along to some brief updates regarding SNAP and Medicaid. But first, just a reminder that for folks who do have questions, if you can just use the Q&A function to put those into the portal, and we'll address those following these presentations. And so with that, I will turn it to my colleague from Unidos, Hannah. Hannah, go ahead and give us an update on SNAP.
Sure. Everyone. Everyone, thank you all so much for having me and for Focus and the CHC for putting this briefing together. I'm Hannah Gerlich. I'm a policy analyst and I hold the food and nutrition portfolio at Unidos US. We're the nation's largest Latino civil rights and advocacy organization. And we have a unique combination of research, advocacy programs, and a national network of nearly 300 community-based organizations. And you've just heard about how important these safety net programs are. I'm just going to share a little bit more about how we think about SNAP at Unidos US, and then just share some of the threats that we're seeing in this reconciliation bill. I know we all may be sick of talking about it, but it's so important right now. Almost 42 million people participate in SNAP, and of those, 10 million are Latinos, of whom 5 million are children. And these are to meet basic food needs. Latinos face higher food insecurity rates. Nearly 2 in 5 Latinos reported that their families did not have enough food to eat in 2023, and that was more than any other racial or ethnic group, and significantly higher than in the past. And when we see families' costs soaring, high grocery bills already create unsustainable financial burdens for many Latino families. And more than 1 in 8 Latino adults have gone into debt to feed their families. Again, more than any other racial or ethnic group. And we've just learned from this excellent presentation, there's so many barriers to access that persist. Language barriers, fear stemming from immigration policy, complex application systems that disproportionately limit Latino participation in SNAP, even when those families are eligible. And so, like I said, we're going to touch on some of the threats that we're seeing to SNAP in the reconciliation bill. And I'm going to highlight some of the top priorities for Unidos US that will hopefully be helpful takeaways in your work and talking points. We've also been sending all of this information up to your offices and many others, and so happy to follow up with those quick fact sheets and all the things that we've been working on. So the first thing that we're seeing as a threat to cut is these expanded, work requirements, but they're not really work requirements. These are paperwork or documentation requirements. And as we just learned, it's really important to remember that most people who can work do work. Work reporting requirements or paperwork burdens don't magically create more jobs for people to participate or apply to. They're expanded requirements that would penalize job loss and penalize low-income families with more burdens of paperwork. We've just gotten the Senate language just yesterday or the day before, and we're all doing that analysis, but initial analysis of the House language, and I think it probably will stand with the Senate language, is that these proposed changes could remove over 1 million individuals from SNAP and reduce benefits for an additional 3.8 million without improving employment outcomes. Arkansas did this a couple years back, and data showed that similar policies failed. It kicked people off the program without improving job opportunities. And, as we've just touched on, Latinos have a very high rate of participation in the labor force, outpacing national averages, and are also more likely to work in those volatile, low-wage sectors like agriculture, construction, and hospitality. And we know that these burdens, along with the many other threats Latino are facing, it will have a chilling effect on Latino participation in SNAP. And expanded work requirements will have a holistic impact on families, especially caregivers and their children. When a parent, grandparent, or caregiver can no longer meet those requirements or forget to turn in the paperwork 1 month or, whatever the barrier is, and they lose those SNAP benefits, that's a cut to the entire family because families eat together. Another threat that we're, closely watching that we think will be really harmful to SNAP is this cost shift to states, both through benefit costs to states and changing the administrative cost shift that right now states and the federal government share. We think that these could force benefits or eligibility and weaken SNAP's role as an economic stabilizer during these downturns. So when recessions happen and when more families qualify for SNAP, state revenues decline, this cost shift would force cuts when help is needed the most. And the result would be fewer people served, just as that need is surging. And it would, for the first time, create a patchwork system for food assistance and no longer guarantee support regardless of what state you live in. These cuts could drain state budgets and force states to, as I said, cut benefits or eligibility, or raise taxes or cut other vital resources like K-12 education or public safety. And for some states with those largest Latino communities, as we just saw on that excellent map, states like California, Florida, Texas, Arizona, states where Unidos US works the closest, state budgets could see hundreds of millions of dollars needed to support the current SNAP need. And when we talk about those error rates that they're saying that they're going to put this structure of cost shift, error rates, I think, are really important to remember. Error rates are not fraud. They're usually unintended mistakes by human error. And so we're penalizing states that probably need more support to fix those systems and stabilize them, rather than take money away from the administration. 2 more big threats that we're seeing that I want to highlight. The Thrifty Food Plan freeze, it would slash benefits from the already about $6 per person a day. ignoring inflation and harming families already struggling with food insecurity, especially Latinos, and it would also impact Puerto Rico, who participate in the Nutrition Assistance Program, and their food package is also based on the Thrifty Food Plan. Everyone will see a cut over time in their benefits. The 2021 Thrifty Food Plan revision, which was authorized in a bipartisan farm bill, was grounded in nutrition science and real market costs. And even with those updates, we've only seen this marginal update, but it still lifted 2.9 million people out of poverty and helped reduce hunger and improve nutrition for working families, older adults, and children. And the last provision is this cut to legal immigrants. It would eliminate eligibility for SNAP for hundreds of thousands of lawfully present immigrants, mainly refugees, asylees, certain Haitian entrants, and survivors of trafficking, and many others who have US citizen children and are in this very narrow bucket of folks who get to participate in SNAP. And we can't really think about these cuts outside of a vacuum. Families are going to experience a double, if not triple or quadruple type of jeopardy with this reconciliation bill and with cuts. Unidos US, along with our partners here at First Focus and AFL-CIO, recently released a report about children under attack by this congressional assault on health and food. 14 million children are in that double jeopardy of getting their health coverage from Medicaid and their basic food needs met through SNAP, and could experience a cut from both. We know that children of all races and ethnicities rely on Medicaid and SNAP, but 2/3 of children benefiting from these programs come from communities of color. Of that, 35% or 11.7 million are Latino children. And even more so, broad in the vacuum that we're thinking about, cuts to Medicaid and SNAP can also in turn result in families being kicked off other programs and lead to reduction in participation like school meals and WIC. Because of streamlined enrollment or broad-based categorical eligibility, where enrollment in Medicaid and SNAP serves as eligibility for enrollment in reduced or free priced meals or WIC, kicking families off these one programs may mean they also lose access to these vital other programs, increasing red tape, administrative burden for both families and schools and agency staff. So a family is going to have to fill out even more paperwork to maintain their family's security. I think it's fair to say that these are policy choices to both cut programs, but also make them harder for eligible families to access. Unidos US is happy to continue being a resource for all of you in your offices, and we look forward to answering questions and continuing to work together.
Thank you so much, Hannah. I really appreciate that as well. And I now have the honor of giving you all the update on Medicaid. Again, I'm the Vice President of Medicaid and Child Health Policy at First Focus on Children. And so I get to lead the policy portfolio related to health coverage and access to care for children. And so when we're talking about the most important programs for kids' health, Medicaid and the Children's Health Insurance Program, or CHIP, are absolutely the most critical programs. They are the backbone of children's health in the United States. Combined, both programs serve over 37 million children, representing nearly half of all kids in the US. These programs help ensure that kids have access to things like routine checkups, vaccines, developmental screenings, and much more of the care they need to grow and thrive. And while these programs are vital to all children, they are especially vital for Hispanic children. While I mentioned that nearly half of all children are enrolled in these programs, in the Hispanic community, more than half of all children rely on Medicaid or CHIP to access the physical or behavioral health care that they need. And in some states, that figure is over 60%, and it's nearly even 70% in my home state of New Mexico. Both programs have also substantially reduced the uninsured rate as well. Since the establishment of CHIP in 1997, both programs have helped improve the number of uninsured children by over 60%. In looking at the Hispanic community, these programs have reduced the uninsured rate among Hispanic children by nearly 75%. So at the time of CHIP, over 1 in 4 Hispanic children were uninsured. And as recently as 2023, that figure was less than 1 in 10. Now, of course, one child uninsured is too many. And so there's still plenty of work to do. But Medicaid and CHIP do serve as the foundation on which we can continue to improve children's health. And there has not been a more critical time than right now to emphasize the importance of Medicaid and CHIP, especially for Hispanic children. As it already has been mentioned throughout this briefing, and as you all know, Congress is working on a budget reconciliation package that will reduce federal funding in these programs by nearly $1 trillion over the next 10 years. That figure translates to an insurmountable cost shift to states that will force them to cut eligibility, cut benefits and services, and cut provider payments for those serving children, which will increase access to care issues and health disparities. The effects on children will likely go even deeper than that, as states will have to raise taxes or cut from other critical areas like public education and public safety. Now, there are many provisions related to Medicaid and CHIP in the reconciliation package, but whether it's reimposing barriers in CHIP, reducing retroactive coverage, increasing red tape for families, or penalizing states for providing healthcare coverage to immigrant children, these massive cuts do hurt children, and they will have significant impacts for Hispanic children. And now, regardless of the outcomes of reconciliation, but perhaps even more important if the bill does pass, it's research like that of Dr. Janetian that was presented to you today that is critical for working in your states and in your districts to help ensure that locally program design does not deter or prevent children from receiving the incredible benefits provided by Medicaid and CHIP. And so with that, I know that we're going to go ahead and move into the Q&A portion of the briefing. Again, just a reminder, if you have any questions, please use the Q&A function and we'll get to those questions. Thank you.
Hi,